First of all, I should thank you for your brilliant performance in the stage, dancing and your music. So, you all have talent. In a 1 hour program, everyone could not be acknowledged. So, I told you from the very first day that you all are talented. With this beginning, I would just speak on basal nuclei or ganglia. Definition: basal nuclei or ganglia are the large masses of grey matter situated in the basal part of the matter of cerebral hemisphere. Functions: the corpus striatum forms a part of the extrapyramidal system and controls the muscle tone, posture and quality of movements. Amygdaloid body forms part of the limbic system and performs a role in the emotional, motivational aspect of movement. The function of colostrum is not known. With this beginning, I will go into the PowerPoint presentation of basal ganglia. The corpus striatum, chorded nucleus, lentiform nucleus. Lentiform nucleus, external medullary lamina, globus pallidus and putamen. Globus pallidus, internal medullary lamina, outer segment and inner segment. Striatum, putamen and chorded nucleus. Pallidum, globus pallidus. Now please, you look at this figure of the caudal section of the brain. You can see the basal ganglia. This is cerebral cortex. This is the putamen. This subthalamic nucleus, substantia nigra. This is the hypothalamus. This is globus pallidus. This is the thalamus, chorded nucleus. You can take this on your phone. You can take this picture on your phone. Now, I repeat, basal ganglia is a picture showing the cortex, the chorded nucleus, the thalamus, putamen, subthalamic nucleus, substantia nigra, hypothalamus, globus pallidus. The definition, what I told you at the beginning of the lecture, this will give you this image or figure. It's a very nice picture. Modern classification. Striatum. Now a dorsal striatum, classical striatum. Ventral striatum, nucleus, accumbens and olfactory tubercle. Pallidum, dorsal pallidum, classic globus pallidus, ventral pallidum. Other structures: the colostrum, amygdaloid body, subthalamic nucleus, body of Lewis, zona incerta, and substantia nigra. zona inserta, field of floral H1, H2, H. This is the field of floral H1, H2, H. Now, the chordate nucleus parts, head, body, tail. Can be a short note. Relations of corpus striatum connections of corpus striatum. Afferent fibers, corticostriate fibers, thalamostriate fibers, dopaminergic, serotonergic, and non-adrenergic fibers, comb bundle, nigrostriate, stria, tonicral fibers. Now connections. Now the connections, direct basal ganglion pathway, the motor cortex. Now glutamate, the arrow shows the muscle movement, muscle and the movements, more movement. Now here from the motor cortex, glutamate, striatum, caudate, putamen, GABA, globus pallidus internal, substantia nigra per reticulata, less GABA here, the thalamus, and dopamine via D1 and substantia nigra pars compacta. You please, in your books, you will find this. Efferent fibers, striatopallidal fibers, pallidiofugal fibers, fasciculus lenticularis, ansa lenticularis, striatonigral fibers, pallidosubthalamic fibers, pallidostegmental fibers. Now connections. You can see this is substantia nigra, midbrain. This is the forebrain. This is the caudate nucleus, the thalamus, anterior ventral nucleus and ventrolateral nucleus. Putamen in green, globus pallidus outer segment, and this is the inner segment. Subthalamic nucleus, and here the supplementary motor area, primary cortex, primary somatosensory cortex. Here the signals go, the dopaminergic actions, and outer globus pallidus, the subthalamic nucleus, and inner globus pallidus, the motor nuclei in brain stem. Ventromedial system, the thalamus, excitatory D1 receptors and inhibitory effect of D2 receptors. Substantia nigra. Short circuits of reciprocal connection, striatum, substantia nigra, globus pallidus, and subthalamic nucleus, body of Lewis. Functions of basal ganglia. Innominata, location, parts, nucleus basalis of Maynard, nucleus of diagonal band, part of the septal area, efferents and afferents. Lesions of basal ganglia. Lesions of basal ganglia, hyperkinetic, and hypokinetic disorders, Parkinson's disease, paralytic agitants, chorea, Seden's chorea and Huntington's disease, athetosis, hemibellismus, Wilson's disease, hepatolenticular degeneration. The Parkinsonism, forward tilt of the trunk, reduced arm swing, shuffling gait with short steps, rigidity and trembling of extremities, rigidity and trembling of head. Parkinsonism can be a short note. So please, basal ganglia, it's a short, this thing, if you draw the pictures, just 26 slides I put in, but you have to read more. But it is sufficient if you know and draw the diagrams. Especially the first, I told you the coronal section of the brain, the location of your nuclei, and also the areas of the brain where it is communicating with. Now, Parkinsonism, the cut section of the midbrain where a portion of the substantia nigra is visible. At this level, and you see the substantia nigra. Now, substantia nigra, diminished substantia nigra as seen in Parkinson's disease. And transplantation of human embryonic dopamine producing neurons in caudate nucleus in putamen. Transplantation of human embryonic dopamine producing neurons in caudate nucleus at putamen. Auto transplantation of suprarenal medullary cells, source of dopamine producing cells. Pallidotomy. Now, this is the 18F fluorodopa PET scan. This is the control. This is pre-symptomatic and symptomatic. Now, the pre-graft, 5 months post-graft, and 12 months post-graft. This is the PET scan picture. It's for the postgraduates. It is for the postgraduate. But you just know that things are in advance. Advance means this in Parkinsonism or any disorders of the basal nuclei. That is in the experimental stage of embryonic tissue transplant. Now, reduce fluorodopa uptake PD, control and PD patient. It's a small, please, you go home and you just know what definition, a short note can come as basal nuclei. You've seen the picture, I've showed you the slides, even you can go into the website of virtualmedstudent.com. This website you can go and see more description. This picture. Around 4-5 pictures you have to know, and it becomes easy for you to study. Draw this picture in your answer script, but Parkinsonism can come as your 10 marks question. or a short note of 5 marks or 4 marks.